Okay, so thank you guys again for joining us, and we're going to get started because Mike has a good presentation. So Mike, take it away when you're ready, and thanks again.
Okay, so Natasha, are we sharing my screen?
Yep, Laura, looks great.
Terrific. Thank you very much, Megan. Thank you for the kind introduction, and it's always a pleasure and a privilege to present with you. This is such an excellent series. I've learned so much myself from being a part of this series, so I'm really grateful for that. So with that started, good morning to good afternoon to everybody, and good morning to our friends in Alaska and Hawaii. We're going to be looking today at some elements of regular mental health evidence-based practices that are actually inherent in the 12-step programs. One of the things that I've come to realize over the years that I've been doing this is that really there's nothing new under the sun. Okay, we just keep rediscovering eternal truths and dressing them up in new clothes so we can sell books, which is probably cool because every generation has to come to some of the same conclusions for themselves. When it comes to the 12 steps, though, and actually any evidence-based practice, it's kind of like the story of the blind men and the elephant. The teaching story is that there's some gentlemen who find an elephant in their midst, and each one of them grabs a different part of the elephant. And one of them says, he grabs the trunk and says, boy, this is a lot like a snake. And the guy who grabs the tail says, no, an elephant is a lot like a rope. And somebody grabs the leg and says, no, an elephant is a lot like the tree. Well, they're all right, sort of, but none of them have really captured the essence of elephantness. And I think that one of the reasons sometimes that we sit in circle when we are in council is that everybody can look at things from a different perspective, but it's the perspective of the whole group, it's of the whole council that is usually the greatest wisdom. So going forward, let's kind of park some of our preconceptions at the door and kind of take a fresh-eyed view of the 12 steps and some ways that they can be really helpful. Certainly, one of the things that's really evident, we're all familiar with cognitive behavioral therapy, and there are a lot of elements of cognitive behavioral therapy that really are inherent in the 12 steps. If we look at the slogans that were, AA is kind of famous for having a lot of these. Really, they're designed to help change our thinking. And so, one of the slogans, I'm not sure if it's listed here, is that you can't think your way into right behaving, but you can behave your way into right thinking, which is pretty much the essence of cognitive behavioral therapy. When we look at changes in behavior, we're looking at some of the slogans, but they're designed for behavior change rather than thought change. Excuse me. And so this is just kind of the traditional wisdom that's grown up inside of the 12-step programs. Very few of these are actually in the big book, but they've kind of grown up and attached themselves like barnacles to the program. One of the things that I enjoy when I travel is I enjoy going to different meetings in different places because I hear different slogans in every place, and I can bring them back to punish my patients with. So we're all familiar with the 12 steps to one extent or another. But if you really look at the core functions of the 12 steps, the first step obviously has to do with abstinence. 2 and 3 really are about the rebirth of hope, being able to come to a belief that there really is a way out of this. 4, 5, and 6 tend to be about learning to live with myself and the things that I've done. 7, 8, 9, and 10 are about learning to live with other people. And then 11 and 12 are about learning why I'm learning to live. So in other words, why am I here? So to look at some history, Ken Minkoff. Now this we're looking back now into the 1990s. Ken Minkoff was one of the first, along with Bert Pepper and Hillary Riglovitz and some of those folks and myself, were there for the kind of the beginning of the emphasis on co-occurring disorders, or as I prefer to call it, double recovery. And one of the first people to kind of codify this was Ken Minkoff, and he had this idea of comprehensive, continuous, integrated systems of care. But what we look at is that really, when you look at it, it parallels the steps pretty closely. Now, I don't know that he did that on purpose, but it really does. They really do kind of align themselves pretty nicely. And now it's kind of been reborn with William White and the recovery-oriented systems of care, which kind of changes a little bit of emphasis, but really incorporates a lot of the same things. Another evidence-based practice that we're all familiar with is motivational interviewing, Miller and Rolnick. And when you look at these, you know, expressing empathy is kind of embodied in some of the self-awareness steps and some of the rebirth of hope steps. Developing discrepancy, in other words, looking at the cognitive dissonance between the way that I want my life to be and the way that it's going now. Certainly steps 1, 4, and 6 and 7 really kind of embody that. Avoiding argumentation, you know, rolling with resistance. All of these things really are kind of embodied in the 12 steps of AA and NA. The Trent's theoretical model of change, which is the fancy name for the stages of change model. Looking at pre-contemplation. There's a great book by a guy named Arnold Washington called Step Zero, which is getting ready to be ready, which really is pre-contemplation. And you know, one of the things that I tell my patients is that you know, pre-contemplation can mean one of two things. Either I don't realize that there's a problem. Back in my misspent youth, I had the perfect pre-contemplation t-shirt. It said, I don't have a drinking problem. I drink, I get drunk, I fall down, no problem. But there's also another area of pre-contemplation, and that is I've misidentified the problem. And kind of the classic example of that I've used, because I've run a number of drug courts in different places in the country, is, you know, my problem is those damn state troopers who have nothing better to do than drive around and find people with burned out taillights so they can pull them over and find meth in the glove compartment. I've misidentified the problem. But as we go forward, then in the contemplation stages, we're looking at steps 1 and 2, that, you know, there are things that clearly are wrong with my life and I don't know exactly what to do about them. I kind of want to do something, but I don't know what, which brings us to the second step. And then we begin some of the preparation things, the coming to believe, and recognizing that there are things about myself and the way that I conduct myself that need to change in order for me to be happy. And looking at making things right, and figuring out kind of what it is that I want to do with my life in recovery. And then there are what we call the action steps, which are really beginning to put these things into practice. And then finally, we have the maintenance stages. And I don't like, they call it relapse or recycle. Those are Prohaska and DiClemente's terms. I think that another way of looking at that is, you know, every time I go through the steps, when I get to this 12th step, I kind of recognize that there's something else in my life that needs attention. And so we start working the steps on that. So we always have this continuing, ever widening spiral of recovery. Another thing from the 1980s, I've been doing this for a minute. I actually was privileged to do a tiny bit of work with Berg and DeShazer back in Milwaukee at the Brief Therapy Institute. Brief therapy has nothing to do with duration. Brief therapy is a different paradigm, a different way of looking at treatment, which now has kind of morphed into what we call solution-focused therapy, is the way that is kind of embodied now. And some of the core tenets are, defining the solution, not the problem. Identifying exceptions, and this is really important. Identifying exceptions. When is the problem not happening? Okay, when are the times that I'm able to maintain my sobriety? When are the times that I'm not tempted to drink or to use drugs? Using scaling questions. This is kind of where this came from. I'm not aware of any earlier examples of scaling questions, but on a scale of 1 to 12, how are you today? And then looking at how to cement the solution. One of the things about brief therapy that I really like is that it's impossible to fail. As long as you're breathing, it's impossible to fail, because any setback that you have is really an opportunity to learn something. So going back to cognitive behavioral therapy, some of the classic cognitive distortions that come from Beck and David Burns, things like all or nothing thinking, looking at the Serenity Prayer and concentrating on progress, not perfection, overgeneralizing. I never, just for today. I can never quit drinking. I've never been able, well, just for today. I'm not drinking no matter what. Mental filtering, recognizing that what I already know how to do is what got me here. Discounting the positives. You are so much more than the worst mistake you've ever made. But unfortunately, it's real easy, especially in early recovery. It's one of the things I think that scares people off in the 12-step treatment programs. It's real easy to start living in the hole in the donut. These are all the things, the terrible things that I've done. These are the things about myself that I don't like and that I really want to change. But it's ignoring the important part. I mean, the hole's important. If it doesn't have a hole, it's not a donut, it's a fritter or it's something else. But the hole is not the important part. It's not the defining element of what a donut is. Jumping to conclusions, learning to listen, clean your own side of the street, stop expecting and start accepting, catastrophizing, recognizing that this too shall pass. Occasionally it's like, this too shall pass. In the meantime, it's not going to feel real good, but there will be an end to it. And another one that's really useful is, 10 years from now, how much is it going to matter? How much is it really going to matter? Emotional reasoning. One of the things that really gets us into trouble is when we start thinking our feelings and feeling our thinkings. Just because I feel something, feelings are not facts. That's one of the core tenets of acceptance and commitment therapy that we'll get into in a little bit. Fears are not facts. Ridicule is not reality. And thoughts are not things. They have no actual substance other than what we give to them. And then the tyranny of the shoulds. You should do this, you should do that, you must do this, you must do that. I call that kind of mental masturbation. The only thing we have to do today is not use. That's all, that's it. As long as we get that one thing right, then everything else is open to possibility. But the minute that I make that choice, in logic, it's called Hobson's choice. Hobson's choice is, would you rather be shot or hung? Is there another choice besides, would you rather be shot or hung? Well, yeah, don't put yourself in situations where your only choices are, would you rather be shot or hung? When I have made a commitment to sobriety, when I've made a commitment to abstinence and recovery, all of my options are open. Include something that I learned from my sponsor a long time ago, including the possibility to drink tomorrow if I really want to do that. But just for today, it's already too late because I've made a commitment to myself and my creator. But once I pick up all of those hundreds of possibilities narrow down to just two. Either I have to try and quit again, or I keep on going. That's not a choice that most of us would relish. Another thing is labeling, live and let live. I like the don't compare your insides with other people's outsides. Don't judge a book by its cover. And being judgmental, I find that when I'm being judgmental about something, it usually says more about me than it does whatever I'm being judgmental about. Again, can't stand itis. This is terrible. There's no way that I can endure this. No, pain can't be avoided, but suffering is optional. We don't have to suffer through this. Of all of them, the 10th step has never been my favorite, but I get lots of practice at it. That's the one where when we're wrong, we promptly admitted it. This slide is actually out of sequence in the handouts that you're going to get. This really belongs to cognitive behavioral therapy, but it got into the section on DBT by mistake. But here it is, and it's in your handouts, and so it's available to you. But what it does is it really looks at the ways in which cognitive behavioral therapy really parallels the 12 steps in very important ways. So backing up again and taking a really thoughtful approach to the 12 steps. For a lot of us, the program has something that we either recommend out of habit or avoid out of prejudice. It worked for me and it's worked for everybody, that I know. And so this is, my way or the highway. Actually, so for some folks, the steps become kind of like the Pledge of Allegiance or the Our Father, something we can kind of recite from memory, but we really haven't thought about them in any depth for a while. So let's look through the other end of the binoculars and let's take a little bit closer look. The first step, we admitted we were powerless over alcohol, that our lives had become unmanageable. Okay, which words just jump out at you? Do you suppose that these are the same words that maybe our clients have some trouble with? So what would happen if we turn that around? That we admitted that our lives were unmanageable because we've developed a problem with alcohol or with meth or with cocaine or with heroin or anything else. It begins to put it in a little bit different perspective. And again, admitting we were powerless. What our clients tend to hear, I suppose, is, powerless means I've got no willpower. Unmanageable means I can't handle any things and put them together, and it means that I'm bad. I'm a bad person. I'm powerless, I'm hopeless, I'm a victim. I've been doing this for a long time. And most of the people that I've worked with in my career were good people who had a bad problem. A few of them were bad people who had a bad problem. But it wasn't the problem that made them either good or bad. It's what they chose to do with it that's really the determining factor. So instead, what would happen if they heard something like, my life is unmanageable because I'm powerless over the laws of physics. When I put drugs in my body, drugs do what they do every single time, except sometimes they do it way worse. Okay. And willpower has nothing to do with it. Now, I think willpower gets a bad rap in counseling. Willpower is critically important in recovery. It's just we try to use it at the wrong time. We try to use willpower after we've started drinking. Where willpower is important is making that daily commitment to recovery, making the effort to call our sponsor, making an effort to attend whatever recovery fellowship makes sense to us, to participate in ceremonies, to live on the good road. So willpower doesn't have anything to do once you start. And denial doesn't mean I'm bad or I'm stupid. It just means that I've got cause and effect backwards. The classic example is, well, if you had a like mine, fill in the blank, wife, husband, job, boss, You know, you would drink too, but what you don't realize is the reason they treat you that way is because you're drinking and you're not a very reliable employee or a very good partner in your relationship. Okay, now come to believe that a power greater than ourselves could restore us to sanity. Of all the steps, 2 and 3 probably cause more people distress than any others, except maybe the 4th step. You know, all that God crap, you know, God abandoned me a long time ago. Oh, so now I'm not only a drunk, but I'm crazy. Yeah, boy, I can't wait to sign up for that. Well, what if the most important words were really came to believe? We made a decision to turn our will and our lives over to the care of God as we understood him. Oh, the God stuff. You know, if I want religion, I'll go to church. Well, you know, God never understood me. Why should I try to understand him? And if I turn myself over to God, he'll just punish me for all the terrible things I've done. Perhaps the important words are, I made a decision. I made a volitional, positive act to do something. Oh, this is the one. Yeah, oh, good. Moral, searching, fearless. Oh, I think I'll go change the oil in my truck. You know, goody, goody. I get to write down every lousy, rotten, awful, shitty thing I've ever done in my whole life. Well, but that's not the important word here is inventory. In an inventory, you count everything, not just the bad stuff. So you think about your checkbook. Do you only record the checks going out, but not the deposits coming in? You wouldn't be able to balance that very well at all. When I used to do 4th step work with folks, they hated it because I would have them draw a line down the center of a piece of paper. And on the left-hand column, they would say things about myself that I don't like and I want to get rid of. And the other side is things about myself that I treasure and I want to keep. And I wouldn't let them put something down in the left-hand column until they could think of something in the right-hand column to balance it. The left-hand column would fill up pretty fast, but it was the difficulty to find something that gives a balanced picture. Admit it to God, ourselves, and another human being. Oh, geez, I just know that I'm the only person who's ever done this stuff. I don't want anybody to know the things that I've done. I'm so ashamed. Oh yeah, maybe I'm one of those poor unfortunates that they talk about in the big book. Well, the 5th step really is how we reclaim our response ability, our ability to respond. Because when I take ownership for something that I've done, when I own it, I can decide what to do with it. I can put it behind me, I can throw it away, or I can carry it around with me forever. But until we own our faults own us. And so this is really a critical step. But a lot of people are really scared away by the 4th and 5th steps because they don't understand what they really are about. It's not about making you feel bad. It's about making you feel free. Entirely ready to have God remove all these defects of character. Well, even leaving your past in the rearview mirror is closer than it looks. The key to the 6th step is not defects of character. It's readiness. It's realizing that if we don't get rid of our old ways of believing and thinking, we're going to be always squirming around in a soul that's 6 sizes too small. And it's like those objects in the rearview mirror. These habits will always be closer than they appear. So, and getting ready to trip us up when we least expect it. Humbly asked him to remove our shortcomings. Well, want to guess what the important words are in this step? Well, when was the last time that we humbly asked for anything? And if we're humble enough to realize that we aren't perfect and wise enough to ask for help, how many of our shortcomings have already been removed? And it's the ones that we are reluctant to give up those are the ones we have to be careful about, because, you know, there's an old saying that it's not the car you see that runs you over, right? It's the one you see, it's the one you didn't see coming. Eighth step, made a list of all the people we had harmed and became willing to make amends to them all. Well, instead of focusing on our feelings of guilt, the key to this step is becoming willing. We became willing. We admitted that there was something that we needed to be able to change with the responsibility that we learned in the, that we reclaimed in the fifth step. Making direct amends. This is not about apologies. This is about taking action on that willingness. The responsibility stuff. This is, the universe runs on balance. And I think in my limited experience, Native folks seem to understand that better than folks in Western European culture. This is an opportunity to unkink our karma. This is an opportunity to make things right by doing a proactive thing rather than kind of waiting around for them to forget about the wrongs that we've done. Continue to take personal inventory, and you know, the words that jump out tend to be, well, we admitted we were wrong. We got an inventory counts everything, the positives as well as the negatives. We saw through prayer and meditation. We all know about this one. Lots of us were kind of put off by the God stuff. And when you read it, excuse me, it's not just the steps. There's hardly, it's hard to find 5 pages in the big book that doesn't mention God someplace. Western folks have enough of a problem with the God stuff. If you begin to equate the God stuff with religion, a lot of Native folks have some real horror stories about what's happened historically with that particular combination. But instead, if we can back up and take the eagle's eye view, if we define it as good, orderly direction, then it's easier to make sense out of it and to turn it into something that's proactive and positive. Excuse me. The 12th step. Reading this one backwards, I think, makes some sense to me. Having practiced these principles in all our affairs, we did have a spiritual awakening. And oh, by the way, we try to carry this message to alcoholics. And the best way to do that, the 12th step, is not about dragging drunks off of bar stools. The 12th step, I think, is living our lives in such a way that anyone can look at us and know that we are genuine, to know that we're for real. And if it's somebody who's struggling with addiction or depression or a trauma history or anything else, to be able to look at us and maybe borrow a little bit of hope that maybe if somebody else can make it, I can make it too. But the perfectionism tends to get in the way. Quote from chapter 5, don't be discouraged. No one among us has been able to maintain anything like perfect adherence to these principles. The point is, we are willing to grow along spiritual lines. So another huge element in the 12 steps has to do with acceptance and commitment therapy. This is actually something that I put together when I was still working with YKHC in Alaska, and actually something that I first presented at the International Conference for ACBS. These are the core processes. Stephen Hayes, the genius behind the beginning of acceptance and commitment therapy, came to this through his own experience of recovery. It didn't happen to be around chemicals. It happened to be around some anxiety and panic attacks and some mental health things. But as he developed this, he discovered that there seemed to be these 6 things that really contribute to a life of what he calls psychological flexibility, able to be reflexive, responsive, and effective in the present moment, no matter what presents to us. The first one is acceptance, and the title of this is Acceptance is Not Surrender. Acceptance is not a passive thing. We tend to think of acceptance like, well, I can't do anything about it, so I guess I should accept it. Acceptance comes from the same Latin root as the word capture. It's an active verb. It's embracing reality, but embracing reality without judgment. That's the key. Cognitive diffusion, or just diffusion, has to do with unhooking the thought from the emotion. It allows us to recognize that thoughts are not things. They have no real they have no real meaning other than what we bring to them. Which is, by the way, one of the really neat things about recovery, because when we begin to change our language, we begin to change our reality. But one of the things that he does, he has people, if you take the word like alcoholic, oh my God, addict, sexual abuse perpetrator, these negative labels, when you say them often enough, they say them out loud often enough, they become just words. One of the things, by the way, about Stephen Hayes is that when he began to realize how important this was, he gave it to the world. I mean, he spent about 20 years. I mean, Francine Shapiro, not Shapiro, I'm sorry, Marsha Linehan, kind of hung on to DBT. She kind of hung on to it, and that's fine. I mean, that's not a criticism, but she wanted to maintain creative control over the ways that DBT is performed and utilized. Hayes gave it to the world, and he said, "Here, go out, do research on this, and let's see what really works," which is kind of how the big book was written. So one of the big things is contact with the present moment, learning how to be here now. Everybody knows 2 of the biggest problems for people in recovery are resentments and worry or anxiety. Okay, if you think about it, resentment is an interesting word. It comes from 2 Latin words, like repeat, and sentire, which is the Latin word for to feel. So what that means is I'm making a deliberate decision to drag up something from the past into the present so that I can feel bad about it now. Anxiety or worry means I'm making a deliberate decision to pull something back out of the future that's not happening now so that I can feel bad about it. Living in the present moment is really the key. Jon Kabat-Zinn is one of the preachers of that gospel. Self as context is a little kind of hard to define at first. It refers to the observing self. It's the thinker without a thought. The thought without a thinker. The Buddhist idea of the person behind your eyes. Another way to look at it is conscience. But you know that you can think about the things that you're thinking, and recognize the context in which you're existing at the moment. Values are the things you most care about. Values tend to be very, very stable over time. They don't change much. One of the assignments that I give a lot of my patients is to write your epitaph. Not your eulogy. He was a great guy and he loved to hunt and fish. No, 1 sentence tops that goes on your gravestone, so that when all is said and done, what did it matter that you were here? Was your life about something of importance, or were you just kind of going along with the flow? And then this is really one of the keys: committed action. Taking all of these things and putting them into actionable activities and things that can be identified. So there's also a handout here. one of the things that they do in some of these folks get really kind of nerdy about this stuff. I'm not a nerd for this stuff, but they look at he has something called the hexaflex. It's the six-sided figure that kind of explains how these 6 core functions operate. We can kind of separate them into things that have to do with mindfulness and acceptance, and things that have more to do with commitment and behavior change and those kinds of processes. And when you look at the steps, it's fairly easy to see some of these steps align pretty carefully with those 6 values. When we look at creative hopelessness is really kind of an interesting concept. Creative helplessness means that my attempts to control the problem have now become the problem. If I am an alcoholic, the only way that I can prove that I'm not an alcoholic is to control my drinking and not get into trouble when I drink. So I keep trying to drink and not get into trouble. That doesn't work very well for some of us. So that idea of creative hopelessness, that what I'm already doing has not worked and I need to do something different. Willingness. The self-assessment in the 4th step has a lot to do with diffusing our language and unhooking our emotional sense of self from some of the labels that we put on ourselves over the years. Rebuilding our relationship has a lot to do with values assessment and what are the things about my life that are truly important. Step 10 is about personal integrity, about being honest and transparent in the things that I do, and when I'm wrong, not trying to cover it up and make excuses. What is my direction in life? What are the things that are important, so important to me that they draw me towards them? And then selflessly helping has to do with, again, that idea of applied willingness. I'm not going to dig into this too much, except to say that these 6 things show up differently in early recovery, middle recovery, and ongoing recovery. In the first, just to use the 1st step as an example, unhooking the word alcoholic from all of the baggage that goes along with it. Sometimes when I'm appropriate for today, sometimes when I'm at a meeting, I'll introduce myself as, "Hi, my name is Mike. I used to be a drunk. Now I'm an alcoholic." What that means is, when I was a drunk, I didn't have any choices. My only choice was to try and make it through another 90 proof Groundhog Day, February 2nd, without getting into trouble. Now that I'm sober, all of my options are open and I don't have to wear that label anymore. Alcoholic is a freeing label, or it can be. Then in middle recovery, it has to do with acceptance and recognizing that, yes, I need to make my life manageable again, and recognizing that I have to do that in the context of other people, whether that's my tribe, whether that's my AA meeting, whether that's my family and my relationship or the people I work with, whatever it is. So each one of the steps kind of guides us through a basic understanding of some of the things that are going to lead us to some psychological flexibility. Again, here, the 4th step, which is one of the really troublesome ones. Looking at how my behavior has not been consonant with my values. Not an easy thing to do, but to accept the fact that because I'm in the process of owning these things, now I can do something about them. And those behaviors now can exist in a much larger context of the recovery-oriented behaviors that I'm doing now. One of the promises, we will no longer regret the past nor wish to shut the door on it. That's what this is about. And then again, the seventh and eighth step, looking at, you know, how has my behavior been at cross purposes with my values? This could be a whole presentation in itself. I'm just kind of scooting through it. Now, DBT, dialectical behavior therapy, is another thing that is very, very valuable, and is also kind of incorporated into the steps. By the way, there's a wonderful manual that's available from Hazelden called DBT Meets the 12 Steps. Comes out of Cedar Treatment Center in, I think, in Denver, where there's a whole workbook that's all built on these 4 core processes of mindfulness, interpersonal effectiveness, emotional regulation, and distress tolerance. And then underneath each one of these, they have this kind of mnemonic or you know, the wise mind accepts and improve the moment and things like that, these kind of ways that folks can remember those. This also is in your handouts. So how does this align with the 12 steps? Well, it actually aligns pretty well. We're looking at radical acceptance of reality as it is. It is what it is, not what it says it is, which is acceptance and commitment therapy. You see how all of this stuff kind of, we're back to the elephant. Hope is creative willingness and the ability to turn the mind towards something positive. Surrender is about radical acceptance. So each one of those DBT core skills aligns pretty nicely with the 12 steps. And what this means is that when you find somebody who is being really resistant to the 12 steps, you have something you can do instead. Personally, I believe that anybody who's serious about recovery, well, and professionally, anybody who's serious about recovery and ignores the 12 steps is an idiot, because they have worked the best for the most for the longest. There's lots of research out there that says it doesn't work for some people. That's very true. But as a professional, I have an ethical obligation to know what else is out there so that I can refer them or use a treatment modality that's going to be effective for them. And DBT is wonderful stuff. And that manual from CEDAR, it's not cheap, but it's well worth the money to get it. Now I'm going to shift the emphasis just a little bit and look at blending science and tradition. This is sometimes called two-eyed seeing, being really able to see with stereoscopic perspective that science has many things to offer tradition, and tradition has many things to offer science. And that when we combine the two, we have something that is stronger than either one of them by itself. This comes from the Mi'kmaq tribe up in, I think it's Alberta, Canada. It's been around for a while. It's been around for about 16 years now. Two-eyed seeing refers to being able to see the strengths of both indigenous ways of knowing and the strengths also that Western research-based evidence has to bring to us. One of the most interesting ones is two-eyed seeing blended approach to seeking safety. Seeking safety is one of the evidence-based practices that is used for recovery from trauma. I'm sure in the next series of trauma responsive care that's going to be offered on Wednesdays going forward, I'm sure that there will be some elements about seeking safety. This is a different approach to that by a guy named Rod Vickers, and again, from Alberta in Canada. What he's done is he's taken some of these core concepts of seeking safety and applied them to their concept, anyway, his tribal concept of the medicine wheel, and looking how people who have experienced trauma, people who come from the experience of trauma. You notice I don't say trauma survivors because that gives the power to the trauma. But people who come from the experience of trauma tend to be kind of locked into some of these earlier stages, some of these earlier parts of the medicine wheel, and unable to successfully transition to the next developmental stage of moving into mature adulthood and having an effective way of living. He has a very heavy emphasis on native modalities that are, fairly, I think, fairly universal, in my experience anyway. But how important those are in combining with the research-based seeking safety. And you wind up with something that is more powerful than it is. Most of us, I'm sure, know about Wheelbriety, the medicine wheel and the 12 steps. Donald Coyhes and White Bison have been around since the middle 1990s. Very, very effective. There's a whole treatment modality. He's got books, he's got everything. But looking at how, again, you put that on the medicine wheel and you look at how these different steps deal with these core functions of finding the creator, finding the help and the strength and the belief to be able to get well, finding out who I am, finding my relatives and the people who can support me, and finding the wisdom of the people who have come before me. Now, something that's a little bit more, this is TIP treatment improvement protocol is what SAMHSA calls these. This is TIP 61, which came out fairly recently. And one of the people who was one of the contributors to this, it was my Iluk Ray Watson Pachinka from Anchorage, from Alaska. And also Ray Daw and Sean Bear have also been contributors to this. So here again, what they've done is looked at these different theoretical approaches and the ways in which two-eyed seeing can help adapt them to native culture and native ways of being in the world. Trauma-informed treatment, looking at how to address things of historical trauma and integrating traditional practices and healing approaches that have been proven for thousands of years to be helpful in healing the soul as well as the body. Here again, cognitive behavioral therapy. The matrix model, honestly, not one of my favorites, but and I'm going to just for a moment, I'm going to do a very short rant about evidence-based practices. Evidence-based practices are extremely valuable as long as we don't slavishly follow the book. Okay, and the reason for that is that these studies are normed on the people that we don't serve. People with personality disorders, people with co-occurring disorders, nobody wants a flaming borderline in their control group. And so we got to kind of take this with that two-eyed wisdom of, okay, there are things here that I can use, but maybe I don't have to be, maybe there are modifications that can be made that are going to make them more effective in my circumstance. This is something else that is just fascinating. The Kongazvek, which is the Yupik word for a toolbox. It's something that you carry around with you that came out of the People Awakening Project up in Alaska. And what they did was they looked at Yupik traditions and what are the ways, what are the resiliency factors that are inherent in that culture. And what they did, rather than coming down from the university and saying, well, hey, here's what you ought to do, they went out to the villages, they went out to the elders, they went out to the youth, and they said, okay, what are the things that really make your culture? And what are the positive things about that we can look at in the context of recovery? And so there are many of these. One of them is what they call the Yuyalak, the right way to be a human being. Looking at the strengths of tradition and the strengths of values that are inherent in traditional folkways, and religious practices and ceremonial practices that are really very helpful for it. Subsistence as a way of life, subsistence as a way to be in the world. And so every native culture, at least every one that I've ever worked with, has their own stories of strength. Native people are incredibly resilient. They're resilient as individuals, they're resilient as families, they're resilient as cultures. And we ignore those cultural strengths at our peril. Something that something the federal government keeps finding out over and over again. That's my opinion, not SAMHSA. But you know, this really is an opportunity, perhaps a challenge, to continue taking the things that the wisdom that's inherent in your tribal traditions, in your grandfather's stories, in your wisdom and ceremonies, and how can we adapt to these in ways that they'll be recognized by Western science, and particularly Western, you know, insurance companies, so that we can bill for them and have enough resources to keep our treatment centers alive. Closing on a slightly lighter note, these are the fundamental laws of the universe. You know, the first three are Ernie Larson. You know, if nothing changes, nothing changes. No matter where you go, there you are. Contrary to popular opinion, the law of cause and effect has not been repealed. Compared to nuclear winter, that's dating me a little bit, but compared to nuclear winter, this isn't a big deal. Reality doesn't care how you feel about it. You know, gravity doesn't care if you agree with it or not. You know, the laws of physics just don't change no matter how much we don't like them. The best revenge is to live well. Nowhere in the book does it say life is fair. I often tell people the fair, at least in the lower 48, the fair comes to town once a year in the summer, and it's got rides and cotton candy. You don't have to be right. We can choose to be happy. One of the big ones is recovery is a contact sport. We can only heal in context. I'm sorry, but the job of Supreme Being has been offered to an applicant with superior qualifications. And the center of the universe, the spot at the center of the universe is already occupied. I think it's good just to figure out how to not take ourselves quite so seriously, because as one of these things says, none of us are going to make it out of this alive. So I want to say, Clayana, thank you for your time and for your attention. If you want to get a hold of me, this is how you can do that. And again, all of these slides will be coming to you. There's a recording that's available, and there are handouts that are on their way and will magically appear in your inbox. So thank you for your time and attention.